Dr. Jar, what are we seeing around the world, and how does the American response compare to the best versions of response that we've seen from other governments?
So our response is among the very worst in the world, certainly among all the major countries. Every major country has more testing than we do across Europe, South Korea, Japan, even Vietnam and Iran until recently have been doing a better job testing than we have. It's really mind-boggling how badly we have done on testing. And, without testing, it's really hard to get a grip on how many people actually have the infection, where the infections are, how widespread it is, and what we can do to respond to it. So I see this as just a catastrophic failure on the part of the federal government and the federal leadership.
Sherry Fink, how much time did the Trump administration have to get ready? When did the early warning go off for them?
I think it was early January when the reports came out of China that there was this suspicious cluster of pneumonia cases and that the likely culprit was a new coronavirus, coronavirus being the type of virus that has caused MERS and SARS, those other bad outbreaks in the past. So we heard about it in January. We had that sequence of that virus. I think it was January 10th. And that's when around the world, there were efforts to start to make the diagnostics that we're talking about.
Let's listen to what the president said today about testing.
And frankly, the testing has been going very smooth. If you go to the right agency, if you go to the right area, you get the test. Now, with that being said, as you know, millions are being produced.
Ron Klain, apparently he was talking about Lindsey Graham. If you go to the right area, you can get the test.
Yeah, I mean, look, first of all, it's obviously unacceptable that only connected people can get tests. And it's probably not even true that all the connected people can get tests. I mean, I think everyone who works in this field has got their email box filled with people who believe they've been in contact with someone, who are worried that they may have it, who have symptoms, who cannot get tests. And that, Lawrence, even just scratches the surface of what needs to be tested. It's not just the people raising their hands begging to be tested, and the president's out and out lying about that. It's equipping our state and local public health departments to go do surveillance to find out where the virus is. Is it in nursing homes? Is it in senior centers? Is it among vulnerable populations? We need to not only be testing the people who are demanding to be tested, and of course we should, we need to be testing the people who we should be looking out for and protecting from this virus.
Dr. Jar, if you could ask anyone in this government anything, whether it be the CDC or Health and Human Services, Mike Pence, what would you want to know from whom?
So I would like an honest answer of when are we going to get tests available to frontline doctors and nurses? When are we going to finally be able to figure out how widespread this disease is? By most estimates I've seen, there are likely many, many thousands of Americans who are infected tonight. But we can't figure out who they are. We can't identify them. We can't treat them. We can't isolate them. And I want an honest answer. And every week we hear from the vice president and from others that millions of tests are being shipped out. But then I talk to state health officials on an almost daily basis. They don't have the tests. They can't do the tests. Doctors can't do the tests. I want to know, when are we going to finally be able to test patients who need the tests?